Hi, my name is Jacqueline Gomez. I am presenting my case study for SPA 6505. I am presenting on a male 65-year-old patient who was seen in an inpatient rehabilitation center. He was first aphonic and had oral apraxia. Then when we had developed his speech, we noticed he had apraxia of speech and Broca's aphasia. He also had right-sided hemiparesis and right-sided visual neglect. This was all secondary to an intracranial hemorrhaging, and he also had a respiratory failure when he was in the inpatient hospital setting. He received, at this therapy center, he received 1 hour of intensive therapy, of speech therapy, every day for 6 days a week. He had 1 day of break, and he received this for 4 weeks in this rehabilitation center. The long-term goal that we will be working on with this patient is that this patient will express basic wants and needs via verbal or nonverbal means, given maximum assistance with 25% accuracy or higher. This patient had oral apraxia and he was aphonic, so since we wanted to get him to coordinate his breathing pattern, we taught him diaphragmatic breathing exercises. The preferred method is to put them on a bed, lying face up, and place their hand on their abdomen so that they can feel their abdomen rising and falling when they're inhaling and exhaling. Since he had right-sided hemiparesis, it was difficult to move him, so he was seated in his wheelchair, and we had his left hand, which was able to move and mobile. We had instructed him to place it on his abdomen and instructed him to breathe with SLP model and with SLP cueing. And he had to feel his abdomen rising and falling as he inhaled and exhaled. Now I want to show you an example on how to coordinate a person's breath using diaphragmatic breathing exercises. I will first model to the patient how to do diaphragmatic breathing exercises by placing my left hand on my abdomen and having myself breathe in, breathe out, and I will tell the patient to focus on my abdomen and see how it's rising and falling. I'm filling the air in my belly and it's rising and then it's falling. Then I will tell the patient that I'm going to count to 3, tapping them, and when I want them to breathe in. So ready? 1, 2, 3. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in. 1, 2, 3. Breathe out. Once the patient is able to breathe using diaphragmatic breathing by coordinating their breaths, we would now like to work on hard glottal attacks so we can close the vocal folds voluntarily to then help them produce speech. Now I want to model how you would work on having the patient produce hard glottal attacks. So you would first model with the patient, explain that we're going to cough as hard as possible. You want to breathe in and make sure you have enough air in your belly and cough as hard as possible. You can use a mirror for both the diaphragmatic breathing exercises and this exercise to have them visually see themselves, and you can stand behind them while you're coughing if they still need more visual cues. So we are going to cough and fill your air and cough as hard as possible. I'm going to count to 3 and we're going to cough together. Ready? 1, 2, 3. Once we have worked on hard glottal attacks and they're able to do it voluntarily on cue by me counting and say 1, 2, 3, cough without the visual model of the SOP, then we know that the patient is able to adduct their vocal folds voluntarily. Now we would try and work on the easy onset method of producing syllables such as ha, he, he, ho, and hu. You can have a whiteboard with the words or the sounds ha, 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 ha to see if they would be able to read it and use it and have them tap each word so that they can follow along, and then that'll help them coordinate their oral musculature. So you would have them visually see the sounds ha, 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 and you would have them do it yourself, model it, ha, 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 ha. Then you would take their hand and you would say it along with them for the extra auditory cue, and you would go ha, 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 ha with your hand. We are now going to model the easy onset method. On the whiteboard, we have written just the phoneme ha. So I'll have the patient tap ha to get them cued to start. So, ready? Ha. Good job. Then we would have ha, 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 ha written out on the board so that the patient can again tap along with me. So ready? 1, 2, 3. Ha, 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 ha. Once the patient is able to produce all the phonemes ha, he, he, ho, hu individually using the tapping, then we'll try and have the patient variegate their syllables by saying ha, he, ho, hu written on the whiteboard again. And again, tapping for the visual support and pacing support. Ready? 1, 2, 3. Ha, he, ho, hu. Once the patient is able to coordinate using different syllables, those variegated syllables using the easy onset method, you would then work with performing words, having them say words using the beginning sound, the H sound. The patient was Spanish, so we started working with the word jabón as an example. So you would have the patient cue them to model you, and you would say, using their hand, jabón. And then you would take their hand and you would try and say it with them, jabón. In this case, it would be preferable to have the word written on a whiteboard, and you can have them tap each syllable. You can also have a mirror for them to look at themselves if the visual cue of the word doesn't help. And there are different ways you can try this. Now we will model how to do the easy onset method using words. On this tablet, we have written jabón, and I will take the patient's hand and I will model what they want the patient to do. We're going to say the word jabón. Ready? 1, 2, 3. Jabón. Jabón. You can also have a mirror if this doesn't work. Have the patient look at themselves and cue themselves. You can have the patient count and just tap if you don't want them to read, if they're unable to read, and look at you and focus on you. It is up to you. Try and have the patient perform automatic speech tasks to see if the patient can produce multiple phonemes at the same time. Automatic speech tasks are normally easier for these types of patients, so that's why we're starting with them first. So we would have the patient produce either the days of the week, the months of the years. I would start with counting. So now we will model automatic speech. You can have the numbers 1 through 5 written on the board, and you would have the patient take their dominant hand, and we would model just me, but I'll still be tapping with him. 1, 2, 3, 4, 5. Now you're going to ask the patient to say it with you, and you're going to count. Ready? 1, 2, 3, 4, 5. You can do this with the days of the week. You model first, SLP model, Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. 1, 2, 3, Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. Once the patient is able to perform automatic speech tasks, we want their words to be more functional so that the family can communicate with them and they can communicate their needs to the nursing and the doctors. You can provide them with an AAC picture device with maybe no more than 9 pictured items of functional phrases that the patient will need, maybe a plate with food on it, and the patient can tap yo quiero comer, yo tengo sed, if there's a picture of a drink, different things like that. So you would have an AAC picture device, and you can grab the patient's hand and tap with them, yo quiero comer. You can also have it written on a whiteboard and tap that first, and then have the patient tap the picture to make them coordinate the fact that they're going to tap every time they need to say yo quiero comer, and that'll also help them pace themselves as they're speaking. Now I want to model how you would have them say functional phrases. On a paper that we have here, we have an AAC device with different pictures. You would have them, you are going to grab their hand and you're going to model first that you want them to say yo quiero comer touching the plate picture. Yo quiero comer. Your turn. 1, 2, 3. Yo quiero comer. You can also have them first read it on a whiteboard. We can read it on a whiteboard first and then have them read it and then take it to the AAC device if they're still having difficulty coordinating their oral musculature. So we would say, yo quiero comer. Ready? Yo quiero comer. Obviously, this would be done all in Spanish, but you get the point. I hope you found this informative, and I hope this gives you more tools for you guys to utilize when you're dealing with a person who is aphonic due to their miscoordination of their oral musculature caused by oral praxia. Thank you.